Range of motion exercises. The initials ROM are used for range of motion. This essentially means that the nurse or patient moves each joint through as full a range as is possible without causing pain. Neck exercises. Extension. Move the head backward. Flexion. Move the head toward the chest. Circumduction. Move from side to side and then in a circular motion. Rotation. Turn the head so the patient faces left, then right. Shoulder exercises. Flexion. Raise each arm from a position by the side, forward, and upward to a position beside the head. Extension. Move each arm from a vertical position beside the head, forward, and down to a resting position at the side of the body. Hyperextension. Move each arm from a resting side position to behind the body. Abduction. Move each arm laterally from a resting position at the sides to a side position above the head, palm of the hand away from the head. Abduction. Move each arm from a position at the sides across the front of the body as far as possible. Circumduction. Move each arm forward, up, back, and down in a full circle. External rotation. With each arm held out to the side at a shoulder level and the elbow bent to the right angle, fingers pointing down, move the arm upward so that the fingers point up. Internal rotation. With each arm held out to the side at shoulder level and the elbow bent at a right angle, fingers pointing up, bring the arm forward and down so that the fingers point down. Elbow exercises. Flexion. Bring each lower arm forward and upward so that the hand is at the shoulder. Extension. Bring each lower arm forward and downward, straightening the arm. Rotation for supination. Turn each hand and forearm so that the palm is facing upward. Rotation for pronation. Turn each hand and forearm so that the palm is facing downward. Hand and finger exercises. Flexion. Make a fist with each hand. Extension. Straighten the fingers of each hand. Hyperextension. Bend the fingers from each hand as far as possible. Abduction. Spread the fingers of each hand apart. Adduction. Bring the fingers of each hand together. Thumb exercises. Flexion. Move each thumb across the palmar surface of the hand toward the fifth finger. Extension. Move thumb away from the hand. Abduction. Extend thumb laterally. Adduction. Move thumb back to the hand. Hip exercises. Flexion. Move each leg forward and upward. The knee may be extended or flexed. Extension. Move each leg back beside the other. Hyperextension. Move each leg back behind the body. Abduction. Move each leg out to the side. Adduction. Move each leg back to the other leg and beyond in front of it. Circumduction. Move each leg backward, up, to the side, and down in a circle. Internal rotation. Turn each foot and leg inward so that the toes as far as possible toward the other leg. External rotation. Turn each foot and leg outward so that the toes point as far as possible away from the other leg. Knee exercises. Flexion. Bend leg, bring the heel toward the back of the thigh. Extension. Straighten leg, returning the foot to its position beside the other foot. Ankle exercises. Extension or plantar flexion. Point the toes of each foot downward. Flexion or dorsiflexion. Point the toes of each foot upward. Foot exercises. Eversion. Turn the sole of each foot laterally. Inversion. Turn the sole of each foot medially. Trunk exercises. Flexion. Bend the trunk toward the toes. Extension. Straighten the trunk from a flexed position. Hyperextension. Bend the trunk backward. Lateral flexion. Bend the trunk to the right and to the left. Rotation. Turn the upper part of the body from side to side. Circumduction. Move the trunk to the side and down a circle.